Hello everyone. Today we are going to discuss few more physical therapies. So let's start the session. The first one is CBT. CBT means it's a cognitive behavioral therapy. It mainly aims to replace patients' negative thinking. In few patients, they will have too much of negative thinking and too much of negative beliefs, and they will take too much mental burden of a small situation. They will take too much stress, and they will have too much of anxiety and depression, and substance use disorders, when I say, they're addicted to alcohol or drugs or smoking, etc. And a few patients has eating disorders, and few patients has personality disorder. They will behave in one way now, and after 1 hour they will behave in a different way. So they will frequently change their behavior. So that is called as a personality disorder. So for all these type of issues, therapist will give CBT, which is a cognitive behavioral therapy. So after this therapy, a patient will have a positive and rational thinking, and they will not have any negative beliefs and thoughts, etc. And they will not have any type of substance use, eating disorder, or any personality disorder, etc. So this is about CBT. And coming to the next therapy, it is a dialectical behavioral therapy. It is called as a DBT. So this DBT is also a specific type of cognitive behavioral therapy. So it is also one of the type of CBT, and it mainly focuses on improving self-regulation and self-destructive behavior in patients. So just like few patients will have a personality disorder, especially like unstable moods and unstable relationships and unstable behavior. So for these kind of issues, therapist will give a DBT. And coming to the next therapy, it is a EMDR therapy. In EMDR therapy, it mainly aims to process traumatic memories. For example, let's say if a patient suddenly suddenly see any shock, and if in case of any sudden surprise, sudden shock, or any sudden dangerous event, any crime situation, if they see any of these kind of things, they will have emotional trauma. They will have emotional trauma, and they will be under shock. They will not behave in a normal way. So for these kind of issues, therapist will give a EMDR therapy. So for these kind of disorders. And coming to the next therapy, it is a transcranial magnetic simulation. It is called as a TMS therapy. TMS therapy is a non-invasive therapy. What is non-invasive? Non-invasive means normally any surgery, how doctors will do a surgery, they will cut the skin and then they will do some surgical things, right? So non-invasive means we don't have, the therapist don't have to cut any skin and do a surgery. The procedure is non-cutting, no cutting of the skin is needed, and they will use a magnet to activate the area of brain in mood regulations. So they don't cut the skin and then do any kind of procedure in the surgery. So this is a non-invasive procedure, and it is mainly useful for treatment resistant depression. When I say treatment resistant depression, it means the patient refuse to take treatment from the therapist. So this is mainly useful for those kind of patients. And the procedure of this TMS therapy is, a coil is placed in the forehead and against the pulses, electromagnetic pulses, and it activates the nerve cells in the brain. So this is the procedure of TMS, and the treatment time is 30 to 60 minutes of a treatment session is needed. to complete this treatment. And we do have a side effects. Patient will get the side effects after this treatment, like a small side effects like a tingling and contraction in face and causing headache, etc. And for this TMS therapy, there is no need of anesthesia. So these are about TMS. And coming to the next therapy, it is a electroconvulsive therapy, which is called as a ECT. And in this ECT therapy, therapist uses a electrical current to brain, and which increases the neurotransmitter levels. And there are some technical terms, neurotransmitter levels like dopamine and serotonin, etc. And these are done under general anesthesia. And this ECT treatment, ECT therapy is useful for if the patient is having a severe depression and bipolar disorder, etc. If it is a normal depression, the earlier therapies, whatever I told you, so those therapists will give that. If the disorder is very major, if they have severe depression and severe mania kind of thing, then therapist will go to ECT. And it basically increases intracranial pressure, and slowly it reduces muscle contractions, and it also prevents any injury which causes in patient during this therapical procedure. And we do have a side effects in this procedure as well. After this procedure, patient might face short-term memory loss and confusion, and that's why therapist will normally take consent from the patient's families, parents or spouse. So they will take a informed consent, and therapist also monitors the patient's vital signs prior to the treatment and after the treatment also. So therapist monitors the patient's vital signs. And this treatment sessions, it will take usually it will take 6 to 12 sessions are required, and typically it will be given 3 times a week. So this is about ECT. And coming to the next therapy, which is a vagus nerve stimulation, which is also called as a VNS. In VNS, therapist normally it is also a non-invasive procedure only. And this non-invasive procedure, in this surgery, therapist will implant a device under left hand side of a patient's chest. In patient's chest, left hand side, therapist will implant a device, and this device delivers electrical pulses every 5 minutes to the nerves, and it also alters neurotransmitter levels in the brain. And this procedure is mainly used, this VNS therapy, it is mainly used for the treatment resistant depression. So, and it also has a side effects after this therapy. Patient may cause, this is also normal basic side effects, these are common: hoarseness and cough and tingling of muscles. That's why therapist will strictly tell the patient that they should not discontinue the antidepressant medication. Whatever medication psychiatrist has suggested to the patient, that they should not discontinue. Otherwise, this side effects may be, the effects may be more. So these are about few psychiatric therapies. So that is what for today's class. In the next class, we will meet with the next topic.